Service Zone Board meeting to order, and I will have Blair do roll call.
Mr. Capitan?
Here.
Mr. Steen?
Here.
Ms. Fry?
Here.
Mr. Hagan?
Here.
Ms. Haugen?
Here.
Mr. Davison? Mr. Madler? Ms. Saar?
Oh, perfect timing.
Ms. Bollinger?
Here. Thank you, Blair. In your packet was the November 4th meeting minutes, and if there was, you had an opportunity to review, do I have a motion to approve, or if there was any changes or adjustments?
I'll move to approve.
Second.
I'll second.
All in favor say aye.
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 Any opposed, same sign. Motion passes. I'm still, my brain is not working this morning. Still on weekend, still on that Thanksgiving turkey is still working. Next item on the agenda is wanted to just take a little bit of time to give a little recognition to Brian as he is concluding his service to the Human Service Zone Board and Social Services. So I wanted to take a little time to provide some recognition to you, Brian. And we have a couple items for you to do that. And I know some people on and in the audience, I know for myself, I had the opportunity to serve with Brian on the Social Service Board when we were a Social Service Board as a community member. So we served, I don't know how many years, I didn't look back at that, but there was a few years that we served together on the Social Services Board. And then as when I came in to be the director in my interview process, Brian was one of the members on that interview committee as well. So I appreciated that time getting to know him, and now on the social or on the Human Service Zone Board as well. So did put together, Brian has spent 28 years, I believe we came up serving. So I wanted to give this to you, Brian, in recognition of your dedicated service to not only to the citizens of Cass County, but to the team members of the Cass Human Service Zone, because you do know a lot of our team members. Your commitment and contributions have made a meaningful and lasting impact to our county and to our zone, now that it's called a zone, but our social services and our department. So I want to give you that appreciation, and hopefully you'll wear a little bit of our merch here. Have a vest for you with our zone logo as well. And you don't have to be a stranger around, so you know our phone numbers. You can call Shayna with any advice for economic assistance. I know, yeah. And you know where our offices are located. So once again, thank you for your time and dedication to our the people we serve and our team members as well. Rick?
Before he takes the mic, just a thank you to Brian. I've been on the Social Services Board as a county commissioner, and then afterwards for about 10 years. And so I've been able to work with Brian for 10 years, and it's always been a pleasure. He's always got great insight, so much background and history on the commission, and always full of good information and some great stories. So Brian, thank you very much.
Anybody else?
I
Brian,
guess I would jump in just real quickly, if I may, as well, and I would just say that along the lines of former Commissioner Steen, Brian was on board and really helping us navigate our way during some rather difficult times when I first came on board, and so that those were were not easy times in some respects, and your leadership and your guidance and wisdom as we were navigating some unique situations was very much appreciated.
Thank you, Brian. Any parting wisdom or advice you have for?
Well, they had talked about doing these zones. It was 1999. And it's amazing how fast the state moved on that. Right? You know, that only took, what, 24 years or something like that? So I was impressed with that. It finally got done. So working on it.
And there might be some cleanup in this legislative session
Yeah.
on that as well.
No, it has changed a lot. I think the biggest thing, the culture for a number of years has been, we struggled with it, you know, and we really struggled with it. And I look at the survey, when they surveyed all the people a number of years back on how negative and challenges in there. And I looked at the last survey here last month, the month before that, and 80+% of people are happy. They're welcome, rewarded. And I know there's still challenges on maybe some of the salaries and some of that hiring, but it's come a long ways. And you know, because we had about 80% it was negative before, and I just got to give, you know, thank you for everybody that turned that around, because it's a lot of hard work. Gail and I would talk once in a while on the weekend. She'd have something going on, and I would go, no, you can't quit though. You absolutely can't quit. You know, so I got to give hats off to everybody that pulled that off. And you know, you always got to keep working on the culture, but the culture surveys have really turned out. So, you know, hats off. That's probably the biggest thing, because you can't keep managing turnover that's at that level and think you're going to get proficiency and the people in this county are going to be, you know, taken care of. So anyway, no, I just want to say thanks for all your hard work.
Thank you. Just noticed as I'm looking at number 5, I think is a carryover from our last, I forgot to take that one off. I don't think we're talking about terms. Are we? I think I meant to take that one off, and it was more about the meeting planning.
Yeah, before you leave that, do we have candidates?
Oh, okay. The candidates. We don't have any candidates that we have not put out there. I didn't receive any input from any board members. So if anybody still has input, we can do that. We don't have a minimum number that we have to have. We have, you know, we will have a new commissioner being appointed. So we do have that. I did have one of the managers provided a name, but we haven't sent out an application because but I did not have any input. Yeah, yeah. So we haven't done anything moving forward. We don't have to do it at a certain period of time. So I guess looking for what your wishes are. We don't have to replace and have a minimum number. We don't have to have that number. So I want to be mindful of that. But kind of looking for that. But I hadn't in this month time, and sometimes that's a kind of holiday, kind of a short period of time to have some time to think about that. But we hadn't had any of input or anybody reach out with any suggestions. So yes, that was, sorry about that. Thanks for bringing that up. So it's still open to that. So if anybody comes up, please reach out because we can go and we can add that at any time. But thinking about meeting planning and one other item, which we're running, there is something in this room right at 2 o'clock that they probably want to come in a little bit before 2 o'clock, which I don't think our agenda is really robust today, so we will be done early. So I think we're fine, but I just want to bring that to everybody's attention. I did put kind of a 2025 meeting planning, like just summary sheet in there to keep us focused. And I thought we could discuss, well, first off, if there's any wishes to change the date or time of our meetings in 2025. Currently, we always meet on the first Monday of the month at 1 o'clock, and I think that's traditionally how it has always been. Go ahead, Rick.
And I think the big reason for that is
Was the-
the county sets their calendar accordingly because they have a lot of Monday meetings that are in addition,
Mhm.
so they would leave that Monday open for
Mhm.
this meeting, so that's on there.
Right, right. And that, back in the social services era, it was mainly the commissioners that were on the board. So I just wanted to bring that up if there was any wishes, if this was a bad time or if this is fine, we can keep it at that time. I just wanted to bring it up with the group if there was any, yeah, once we're used to it, it's good to keep it that way. Just wanted to bring that up. The second bullet point on there is topics. I know this past year we've made it kind of a regular cadence to spotlight a program. And we will probably, unless it's the board's wishes, not to do that, but I would most likely encourage, I think it's important to do that. But I would also like to engage, I have met with Carrie, and Carrie's online in the month of October, I believe, yes. Carrie and I met, and we kind of talked about, and maybe she would be open to being the first in 2025, but kind of presenting about like having a board member kind of present and how that engagement with the zone and some of like job service, that what that looks like, and from that perspective, and some ideas and things like that. And she kind of took off from there. And I thought that might be, we could learn, I could learn, those team members, you know, management in our audience could learn, and we could learn from each other and kind of go from there. So that was one idea we had discussed, or any other ideas of interest. If there's speakers, I know in the past we've had the director of zone operations come in. At one time, Jessica Thomason, she's like HHS's, I can't remember her title. She's like the executive director of human services. So, you know, there's quite a few programs that come under her, under HHS. And we know, I'm sure maybe you're not all aware, I should have included that in my report, but the current commissioner of HHS, he will be done on December 15th when the new governor takes over, and there has not been at this point in time that I've heard of any other HHS new commissioner appointed at this time. So I'm sure that will be coming soon. And so has the Department of Health. Dr. Wiebe has will be stepping down as well. So, Rick?
Being a legislative year, it might be good to have a couple of updates during the year. And it doesn't have to take up the whole meeting, but who's ever be on top of that from a county perspective to update us as almost a legislative update. And I know you have those scheduled, Robert, at some point in time, but something pertaining directly with, you know, how it really works with social services. That'd be something I think would be interesting to have this year. Anything we can do or reach out to legislators, you know, bring that to our attention as well. I know we've got one on the board, but he'll be busy.
Yeah, I
So-
don't expect to see Kyle,
Not
you
much.
know, at all until maybe May. Maybe April,
Yeah.
maybe May. Yeah.
Yeah, I guess the only thing I would add to that is that now you do have a zone board member who is in the line for leadership within North Dakota Association of Counties. And so Kim Jacobson out of Agassiz Valley has always been pretty involved in legislation. And I would imagine with that role, she would even be more so. I think as a county, we're looking to have the similar cadence to what we've had in previous years, where we have a call with the association on Friday afternoon that kind of reviews legislative activity of the week and game plans, the next week's hearing schedules, because those come out noonish on Friday, and so I think we're going to have a similar wrap up and schedule county wise. I don't know this for certain, but I would imagine among the zone you have a call sometime on earlier Friday afternoon.
Yep. That, actually, tomorrow we're meeting for a legislative planning and strategy meeting in Bismarck, and that's one of them. But in the past, the last session, I think it was Friday afternoons, is when that meeting was, the call. Yeah, so we could do something like that. And if Kim wanted to give that, she, like Robert said, she's, what is it, fourth vice president with NADACO now? So, or
Third, I
third
think.
or whatever. And then she is also the chair of our zone association under NADACO, so she's pretty much involved in that. And she does a lot of our testimony at the legislature. But actually, all the different zone directors do spend time. There typically is somebody in Bismarck during the whole session, especially in the human service committees. And we'll kind of hash that out tomorrow. And of course, it depends on what the topic is and how that goes. We'll have a little bit more of that going on tomorrow, but I think that's a good idea. And I'll bring that to the board when they meet. Any other thoughts or?
Yeah, I'd say the program spotlights have been really helpful, that those should continue going forward. Good education for us. As a nonprofit organization serving on the board, I'm happy to have a session or a part of a session where we get to talk about our work and how we interface with the zone.
Okay.
Also, I wonder if, now that you have a couple of years under your belt and this entity has a couple of years under its belt of being in this form, if there's other things you've identified, ways this group can be helpful, even if, as part of the meetings, there's a call to action at the end, or how we could help you until the next meeting. Mm-hmm. If there's any, and sometimes you have those when there's been employee appreciation things or other things, but if there's anything that we could be helpful outside of the meeting, you would, inform us as we left about how we could better serve in the time between meetings.
Thank you, Julie. I was just thinking as we have a employee appreciation next week, and I'm like, oh, we got lots to get done before that. I was like, it's kind of little, it's not little stuff, it's important stuff, but I was like, ooh, we got lots to get done.
I think that is important. If
Yeah.
there's ways we can help with stuff like that,
Yeah.
I think we'd be happy to if our schedules
Thank you.
allow.
Thank you. Yeah, I brought this big bag of stuff. I'm like, okay, arts and crafts here, like things like that. There are things we need to get done before Tuesday. Yeah, thank you. Anybody else? Thank you. We will keep some of that, and like I said, reach out anytime. The next item was the meeting months. I know this last year, we did start out with 12 meetings, and I took it the liberty to propose the following schedule for 2025. Instead of, it's already December, we lose a couple weeks at the end of the month, and really, I don't want to say not much happens, but January, it comes really quick. So with a session starting, I propose that we start out in February. We can do our officers and all of that in February. And then we meet February, March, and then skip May, February, March, April, skip May, June. This last year we didn't meet in July. August, skip September, October, November, December. We can always have a special meeting or add in a month, but that gives us really a good cadence, and then we can, if we need to meet, we can add that in. Any concerns with that? But it would make a good use, I think, of everybody's time. And if that fits in, we'll keep that. Oh, we send out the packets in our handbook. We always say we send out the packets the Tuesday prior. The issue with that, like, do you want them that early? Don't need them at all?
I would think so. I'd like to get them, but that seems like early. It's gonna
Okay.
Things happen, you add to it, maybe
Okay.
later.
Okay, okay,
Thursday,
okay. It's always been traditionally, that's what, in the past, so,
anyway, as long as we have before the weekend.
okay,
I agree with Rick. I was going to say
Before-
Thursday seemed reasonable.
okay. Thank you.
I get them that early, I'm thinking, what's the meeting? I mean, honestly, that's my reaction, is that what's next week?
Yeah, sometimes it's the metrics too, and now, like, yeah, we can't get, the other reason doing February, we'll have a little better time to get year-end 2024 metrics together. We can't get them together by the first part of January when we do that, so that will be helpful too. So, thank you. Any other things for discussion on that? Let's see. Otherwise, the operations report is in there. Basically, it talked about our last directors meeting. I'm not sure if you noticed, there was hyperlinks in that report. Under the administration, there was a few forward-facing, public-facing, I should say, EA dashboards that are out on the HHS website, and I put the hyperlink inside that document. If you click on it, you can get like the child care assistance, and you can drill down into Cass County. So you can see the investment, you can see the dollar amount. There's a lot of data out there, actually. So that's kind of helpful. The same with the LIHEAP, the fuel assistance dashboard, as well as Medicaid, those that are eligible, and those that are eligible by county. So there's getting to be more and more forward-facing or public-facing dashboards out there that you can drill down. There is dashboards out there. That's why some of our data in our dashboard for you all, the economic assistance one, has been a little off because they've taken the dashboards that aren't public-facing a little bit offline because some of the data was not totally accurate, and we haven't been able to replicate those as they're getting them back up for us to do. But I just wanted to make you aware that those are links if you want to go out there and look at that. Those are really good links. Then just a couple of pictures about, we had our Worksgiving, so like, Friendsgiving, Thanksgiving, all of those things. The team did a Worksgiving event for our team members, and it was very well attended and a really creative event with a lot of food. So that was wonderful. And then Economic Assistance and Family Services provided a little snippet of some updates within the last month. Really keeps going through the same things that they've been doing. And then the dashboard kind of gives you a little perspective of some of the updates. And once again, on the economic assistance one, you can see we don't have we just mainly have our walk-in data. We don't have the trending data that we've had because those dashboards aren't available for us currently. And then the data for our staffing and turnover, the projected data, the turnover is only through the end of October, just because of the timing. And then some of the others is through November.
I had a question on the dashboard.
Yep,
Back on the economic assistance walk-ins.
yep.
So, I'm curious, I know this is somewhat seasonal the way this works, but from May until October, we had about a 42% increase in walk-ins. That's something going on, something different.
I would,
That's a pretty significant growth.
well, fuel assistance, probably Medicaid or healthcare. I'm looking at Shayna behind you, Rick. The call center,
backlog in the call center, we can see an increase in walk-in traffic. April, generally, there's a lot of changes to healthcare coverage for elderly and disabled individuals. So that can see a lot of walk-in traffic.
then it goes down.
Then it goes into like meeting season, things like that. So it just kind of depends on, and sometimes depends on what our volume report looks like. The childcare assistance saw a large influx of applications because of a few policy. And so that would have probably driven a lot of traffic. It's kind of somewhat similar.
Yeah, since I have like more than 12 months, it's hard for me to identify that. But I
Yep.
just saw a steep, increase, and I'm thinking 42% increase in your walk-ins has got to put a little bit of stress on the people in there. Making it fun off, I'm guessing.
And there's, it will be curious to see now recently, even from like November, I'm curious to see from probably August through the first quarter of this next year, because the customer support center or the call center is seeing an increased backlog of phone calls. That's going to, my theory, we're going to see more walk-in traffic because people are going to get frustrated. Right. Because they want a one and done, which if I call, I want to get my problem fixed. They can walk in, but then that also will produce, because support specialists are also scanning in all the, they're in charge of all the paperwork in the work queues. So that can produce a backlog in all of that, which there already is because of the healthcare coverage and LIHEAP and things like that. So then that produces a backlog in the queues system to get the work, which then just produces more calls because then the work's not getting to the workers. So it will be interesting to see. We're already doing overtime. The support specialists are encouraged to do overtime if they can across the state. It's not just us, it's across the state. It will be interesting to see what the first quarter of 2025 brings, because the proposal now is that the support specialists will be, I'm not quite sure when it's going to be out, but support specialists. So our support specialists, we have 6, 5, 7, 8. I'm like 6, 5. But there's 2 or 3 of them that full-time see walk-in traffic. The other ones like are doing medical transportation and the behind-the-scenes work. But now support specialists across the whole state will also be an hour and a half a day doing calls, answering phones as backup to the call center. I voted no again. I voted no on that, just saying. I voted no, but I'm only one of 18 because I said, we're going to see an increase in walk-in traffic, and I have to protect the people. You know, we need to serve the people that are walking in. So it will be interesting, but
So just a question on the backlog. So when you talk about backlog, it's not calls that aren't answered or returned. It's work that's still in progress, cases that are open. Is that what the backlog means?
it could be some of both, Julie. It could be some of both, because if the calls aren't answered, it's probably because their case isn't being worked. I'm just suspecting, because it's not getting in, or, you know, there's a question on it, or whatnot. Yeah, so
And are
it's
you
just
informed by the state what the backlog is?
well, we know what the backlog is,
Okay.
you know, yeah. It's,
That's not one of the things here.
no, we don't have that. Well, our workers, our supervisors all know, because we look to those things that are coming up, like the expedited SNAP. If those dates are coming up, our supervisors get those out to workers to get those done by the time frame, you know, that it's supposed to be. Because every morning, there's a spreadsheet that goes out, basically, because the system doesn't necessarily punch those through. We have to do them manually. Am I explaining it the correct way?
I mean, the backlog we refer to, I mean, that's more
Generic.
generic in general, just because at any given time, the backlog is different. So currently, what we're experiencing is a backlog of childcare assistance items. Because of a piece of policy, we've had that growth in applications for childcare assistance. The heating assistance, because we're in the beginning of that season. So when all of that's coming in, that's where those backlog items are, because only certain workers know certain programs. And so sometimes when things are siloed, it's kind of like that's where the backlog lies. Also, open enrollment for healthcare coverage has created more volume with healthcare workers. And so it just depends on point in time. When we're referring to, you know, backlog in terms of calls, it would be calls unanswered or calls that are waiting longer than maybe we would want them to. And a lot of that is because we did have a group of individuals that were contracted through Deloitte to do sort of a quick answering of calls, easy questions that didn't necessarily need an actual eligibility worker to answer. And that those group of people have now,
They're gone.
they're no longer. And so we are left with only our normal call center staff. So they're getting all of the calls where it kind of had that buffer to begin with. And so that has resulted in some of that sort of telephonic backlog.
Just, I think often the plan is like, we'll fix this over here without necessarily thinking, how's that going to fix this over here? And that's part of the reason I voted no do it, because I was like, we're just going to kick the can over here, and then this is going to go down. And then we need a, like, let's think, what are we truly right-sized? And how are we going to fix this? And I know it's a big, like, there's probably a lot to it, and you can't just fix a system. Like, I get that. I get the computer, like, all of that is huge to fix. But let's think about what is the correct fix, or at least, what as a whole state can we fix, to not just say, oh, let's do this, and then guess what? Then this lane is going to be, and then we're going to say, oh, let's do this. We've been doing that for 2 years now. So, yeah, I was a dissenting vote, but I'm one.
Gail, I got a question. Can I still ask a question?
Yeah.
Um,
Just till 2 o'clock.
Yeah, last one. I'll keep it short. So I sat on a number of those workforce task force meetings with the Dalba Group out of New York. And their plan was to bring in 200 to 400 immigrants starting October. Mainly Haitian, Venezuelans, so you'd have some culture differences there. But if they're coming in at that level, that has to be impacting your numbers too, though. And then they were going to fly them into Fargo. And that was, I mean, there was a lot of people in the meeting, so it just wasn't me. I did orchestrate it with Sanford and Ascension, a number of other companies, but are you seeing that? I mean, is that number jumping? Because that would impact your area. I mean, are you seeing those numbers escalate?
Our numbers are just like, oops, as a whole, because it,
No, but
like,
I mean,
it
you
could,
had-
it
you
could.
had 300 a month. I would assume they're all going to come in here to get. You got to sign
Well,
up.
No, so because it's statewide.
they could
anybody
apply
that
online.
applies, They can apply online, and if the work is assigned broadly
It-
across the state, so it wouldn't be isolated just on
Yeah.
this, taking on with that.
Can you guys hear me? This
Yep.
is Carrie. So I just want to say that probably the best source of numbers on immigrants coming into the state of North Dakota would be Holly Chiskadali at the state HHS level. And she would be able to answer all of the questions in terms of number of immigrant arrivals and the different types of visas that they're coming in on and have come in on during this last year. She'd probably be happy to come and talk to the board too.
Oh, that would be good. Yeah, thanks, Carrie. Yeah. Any other items?
Going back to the topics for the meetings, I wonder if it might be helpful in the February or March meeting if there could be a 2025 calendar, not of the meetings, but of things going on in the human service world. Like, is there I mean, I'm sure there's all sorts of dates of things happening at the state that it's like when this part of your programming was centralized, when this computer thing changes. It's like all of these things that impact the work that we hear about, but we don't know these things occur, or like things that changes in policies that then have implications on numbers that we look at.
Like a
It's just
timeline,
just like in the 2020 in 2025, here are some things that we maybe should know about as we hear about these things.
Is that proactive, or as they occur so we can train it for the year?
Look ahead.
Look ahead in
Looking ahead to
2025.
My fear would be how much is known.
Yeah,
Sure.
some of it we don't
Sure,
know.
right.
Yeah,
It's just a thought.
yeah. I think there's some of that with EA as far as, some TANF modernization, some of the SNAP, but as far as their time frame with that, that's where we struggle, because I'm not sure if there is a time frame.
There currently, I don't know that there is.
TANF modernization thing is going to be an ongoing months out project, so that won't be done anytime soon. I think we're only meeting like once every 2 to 3 months.
Yeah, yeah. It kind of is that, like Rick said, the balloon goes over here, it doesn't quite pop, and then it balloons out over here, and it's, yeah. And I get it, it's a lot of different programs, and it's, SNAP is an issue, so, yeah. But
Yeah, or if
maybe
you know in
look at
advance
that.
of any, are there audits that occur in 2025 that we would then hear about? Or
Yep.
there was ones this year where you wanted people to maybe attend if they could, or anything like that
Or
that you
even
know of
like
in the coming year.
in family services, case management's going through redesign.
Yeah, things
And
like
there's
that.
updates on that. So we could share kind of where that time frame is, the expected time frame. Yeah. Thanks. This is helpful. Yeah, very helpful. Any other things to bring up? Not? I would entertain a motion to adjourn. Second? All in favor, say aye. Thank you.
Thank you.